Okay, we are just 8 minutes behind schedule, which is not bad. Given all the conversation, all the information. I know there's some awesome table sharing going on, and I almost feel badly interrupting it, but here we are. But we're doing great. We are staying on track, and this is the last segment of our day today, and this is going to be fantastic. It's been such a productive, rich morning, and it's about to get even more so because we're going to hear from another panel, and we're going to hear more from you. So in about 20 minutes, we will bring you into the conversation. Runji is running the microphone. So Runji, where are you? Anyway, there she is. So when we get to the Q&A portion, just raise your hand. Runji will come over to you. For both audio quality and sanitary reasons, we ask you not to take hold of the mic yourself. We'll just have Runji hold on to it. So it is my huge pleasure to introduce 4 wonderful guests who I've had the pleasure of meeting before on Zoom, and it's doubly great to see them in person. We have Donna Benton here, Director of Planning and Community Development for the City of Dover. She is President of the New Hampshire Planners Association. Donna, it's great to see you in person. Also with us on the end is Mark Bonta, came all the way from Littleton to be with us today. He's on the Advisory Council, the Recovery Friendly Workplace Initiative. Mark is the plant director of Genfoot America, and he works directly with White Mountain Recovery Homes in Littleton. He's done a ton for recovery housing. And Mark, thank you for making the trip. Really appreciate it. Also with us here next to me is Daisy Pierce, Executive Director of Navigating Recovery of the Lakes Region. Daisy is on the State Health Assessment and Improvement Plan Advisory Council. And Daisy, good to meet you too in person. And last but not least, Bill McKinney, Building Official Manager for the City of Nashua and President of the New Hampshire Building Officials Association. And Bill, a big welcome to you too. We're looking forward to hearing Nashua's story. But first of all, we just came out of those amazing roundtable discussions. It was so interesting to hear all of you sharing out. So I think, Mark, to you first, actually, what did you learn from your own roundtable discussion, and sort of what do you come away with?
Well, there was a lot of different perspectives, a lot of common themes that we, all the tables kind of brought about. But I think one specific one was the sub-issue of not just enough recovery homes, but not enough for single mothers that have children. Because it's very true. In Littleton, we've got 2 men's houses and we've got 1 women's house, and they're all none of them really have that sort of capacity. Luckily, Keith, the owner, Sean knows him well, was able to come up because that actually it affects one of my employees who's pregnant right now, and she was looking for other housing. Keith really felt that her boyfriend she was living with still needed the structure, so he actually provided a kind of a small apartment for them. So he's a really compassionate owner, though, and whether or not that kind of infrastructure is out there to do that is, I think, one of the barriers that was new.
So that was one of the big takeaways for you, and we'll talk a lot more. But how about you, Daisy? What did you sort of get from your own table or from that wider discussion, which was just so interesting to hear from all the tables? Go ahead.
So I've actually been most struck today by something Kim said earlier in the day, and then it came up again at our table, which is that there isn't as much recovery housing in the state as some of us have assumed. I guess I've just been living in a privileged world in Laconia where we have a lot of recovery housing available. And it's not that way in other parts of the state. And so we've got to do a lot to spread out past that 93 corridor.
Yeah, again, I think a lot of us were struck by that vision of empty spaces in the state. Go ahead, Donna, how about you? What struck you about all those conversations, maybe at your table or the wider conversation?
Yeah, so I think certainly a major theme is the education needed in order to try to reduce some of that stigma, reduce some of the myths and misconceptions that you might see in a recovery house. And then also to understand how much support is out there and where to find that support, whether it's a parent support group or what have you, but just to kind of figure out those resources.
Right. Did you learn anything that you didn't know before?
Yeah, I was just surprised by some of the numbers, and actually from our first a segment today, the fact that only 30 states in the US
Yeah.
have, our version of New Hampshire core is, I think, crazy that there's, 20 states missing that. So I think it's great that we have one in New Hampshire and that it's well known and well respected.
Yeah, I've learned a lot today too. That number that Daryl gave earlier, 60% of people who live in recovery homes succeed in recovery. Daisy was surprised by the fact that there were these big pockets. So we're all learning. How about you, Bill? What sort of came out for you from all these discussions today?
Well, I've been involved in this for several years with the fire marshal's office, Kim Bach, trying to work through the hurdles of codes and regulation. And I think during our conversation on the table, the most unique comment that was made that kind of struck me was the comment made, "How would you like us in your backyard?" So to all of us that are code officials, policymakers, community leaders, if we are blind to the fact that the problem already exists in our communities and we're not doing what we should be doing to recognize that and solve it, that I think really strikes me the most thing is it's already here. We have the barriers of codes and regulations. How are we going to get those to, how do we mold those so that we make recovery housing more prevalent in New Hampshire and not just in our big communities, Manchester, Nashua, the other communities that are larger, we know the problems there. It's the smaller communities that you are not realizing the problem is there and they're your neighbors and we need to find a way to resolve it.
Well, and Bill, hold on to the microphone for a second, because I did want to ask about your city of Nashua in particular has a story that illustrates a lot of what we're talking about here today. And my understanding is that Nashua initially tried to keep recovery housing out of the city, but then did a whole turnaround and decided that that was not the right way to go. So describe what led to that decision, Bill.
And Nashua never tried to keep recovery housing out of the city. Like every community, the hurdles were, how do you fit recovery housing into your local land use regulations, your building codes, and your fire codes? Okay, the codes recognize buildings by uses, and recovery homes are not a defined use in your building and fire codes. So how do you try and make that fit? And I think Sean Toomey earlier made the perfect analogy is we live in this box, or as we say in our chapters of the codes, and they sometimes prevent us from allowing uses such as recovery homes in New Hampshire. And it's not a local issue, it's a statewide issue. I use the example of accessory dwelling units, if anybody is familiar with those in the planning world. The building and fire codes don't recognize them, but they're out there and we've had to find a way to make them fit into the codes. So what really needs to happen is the codes themselves need to be adjusted, amended in order to recognize recovery homes so that the code officials can be comfortable with making that decision that this is an allowable use and this is how I can allow it. That's the most important thing. And so in Nashua, again, because the codes kind of just kept us in this box, we had to think outside the box, and we worked with our city planners, and we actually sat down to a point where we pulled together all of our key people in the room, and we actually brought some of our recovery homes folks in with us to meet with us, and that involved myself, our fire marshal from the city, our code enforcement folks, our planners, our zoning officials, even the health department. And we all sat down and we worked out through a process that we thought would work. Is it perfect? No, it's not perfect. We are still looking at how to improve upon our process. And is the process that Nashua goes through work for everybody else? Absolutely not. Every community has different needs and different challenges. But I think at some point, you as the code official or the policymaker have to be comfortable with saying, can I move the line just a little bit to make recovery homes work in the community? And I think it really comes down to the benefit versus risk question that we ask ourselves every day. Where's the benefit?
Well, and we've got another planner on our panel. So Donna, how do you see the role of planners? How are they helpful or not helpful when it comes to recovery housing?
Yeah, absolutely. So I think planners in general can be looking at your regulations and your codes to see what obstacles are in place for recovery housing. Certainly, we've heard some this morning. but they don't always have to be. So in Dover, we don't have a specific use. It's residential and it's single family. We don't define family, and it makes that box very flexible. And that way we might not know about every recovery house. Certainly, we hope that they get certified and go through that process and meet those rules. I think it helps with the abutters and try to help keep some of those concerns down that we might be seeing. But in general, that box can be flexible if you consider it residential, which is what it is.
Sure. So as a planner, what barriers or concerns do you see coming up when it comes to establishing recovery housing in Dover?
So in Dover, not really any, because we just consider it single family. So I think in smaller communities or other communities, to be looking at your parking regulations, if you define family, and just in general, looking at your codes and your zoning to make sure that there aren't obstacles, but also making sure that you have opportunities if someone wants to bring in a recovery house, that the process is clear, you get the key players in place, and that you're not giving people the runaround.
I'm interested by what you just said, Donna and Bill, about getting the key players in place. And I love that image of people in Nashua coming together in a room and saying, what do we do? Was it like that in Littleton, Mark? How did Littleton sort of get on this path? And seems like did it pretty well, because you've got recovery housing, you've got a recovery focused employer like yourself and so forth. So was there that gathering of the minds in Littleton as well?
No, there wasn't. It was a bit of a coincidence in Littleton, actually. Keith from White Mountain Recovery Homes came into town and started opening up the recovery home about the same time when the Recovery Friendly Workplace Initiative started going around to different towns in the state and having orientations and all that. And so that coincidence was a happy coincidence, because it just kind of blended very well. There was a lot of, with Keith's crew and some of the people in our public health community had the experience. And then there was guys like me that didn't know anything about it that were able to come together. So from the very beginning, for Littleton, opening a recovery home wasn't a problem. It was a solution, right? So we talked about data earlier. A lot of tables are talking about getting data. Now, getting data across the state from all these recovery homes of 60% are successful and things like that. It's going to take a long time. It's going to be difficult to do, to collect that data and analyze it, et cetera, et cetera. Would be a lot easier, in my opinion, if we kind of take a look at it from the Littleton perspective, is get some data about the problems in those communities. How many drug overdoses are there? How many drug-related arrests are there? How many domestic violence that is a result of alcohol abuse or drug abuse? Get those data. It's going to be a lot quicker and easier to get those data from that one community that you're trying to get. And then present the recovery home as, here's your solution, right? Because it's going to address this, it's going to address this, it's going to address it. It's going to improve the community. It's not something to be afraid of.
So it's how you
Drugs
frame
are
it.
bad.
Yeah.
Recovery is good.
Yeah.
Right?
Yeah, and I remember you said that when we talked on the phone. You've really been a powerful advocate for recovery housing, Mark, and give us a little bit more of that basic message about why communities should embrace recovery housing. You started to go there, so yeah, go ahead.
Yeah, absolutely. I mean, it's like I said earlier in 2018, it was very new to me. I never really heard of recovery housing. I've heard of halfway houses and things like that, and sober houses, but never heard of recovery houses. And I went to when Recovery Friendly Workplace first came to town, and they were having the orientation. The first thing when they started telling me about this initiative and some of the thought patterns and all that, it immediately made me think of an employee that I fired back in 2011 for coming to work under the influence of alcohol. She came in smelling like alcohol four days in a row. I finally brought her up to the hospital. I got a breathalyzer. She blew like 8 times over the limit. So I drove her home, and at the time I thought I had no other choice but to terminate her because she came to work drunk. So I did, and she was crying up her stairs to her apartment when I let her out of the car. Unfortunately, well, not fortunately, but tragically, within 6 months of losing her job, she died of liver failure because she couldn't stop drinking. And so the thought pattern of coming from this other area where there's solutions to this, and you don't just give up on somebody. Immediately made me realize that she still could be alive today if people were thinking of that. Again, the Recovery Friendly Workplace Initiative is a solution. It's not a problem. Recovery homes are part of that, you know, because I've been working now with White Mountain Recovery Homes since 2018, since Mr. Sean Canizaro first came working for it. He was one of the first ones that we had hired from White Mountain Recovery Homes. And he had a buddy named Kevin, and I won't mention the last name, that came in as well. And I'm very happy to see Sean again here today. We often double up on these things, so I see him a lot doing this. But, you know, being a recovery home owner now and following that calling and doing a lot of good out in the community. The other guy, Kevin, who I won't say his last name, he doesn't work for him anymore either, because he's gone beyond that as well. He's now the treasurer for the Chamber of Commerce.
Wow. So lots of potential for communities, a source of community strength.
Yes,
Yeah.
absolutely. There's a guy up in Littleton, Jamie, who works for White Mountain Recovery Homes, that has a saying that's saying Littleton has an epidemic of recovery.
Wow. Well, and I don't want to forget you, Daisy. I want to know a little bit more about your model of recovery, because every recovery home is slightly different. So tell us a little bit more about Compass House, please, and how its model of recovery might be slightly different from other recovery homes.
Sure. So Compass House came about as a collaboration between 3 nonprofits. There is an affordable housing developer, a outpatient treatment center, and a recovery community organization. And so the 3 of us came together and we wanted to open up a recovery house for women. And luckily, New Hampshire Housing Finance Authority put out some funding. We were able to apply for it, and Compass House was born. So what makes Compass House a little bit different is that the women have to be coming out of either treatment or corrections. They can stay there for up to 2 years. It is transitional living. It's affordable living. So we charge them 30% of their income is their rent. And it's co-occurring. So because we have the outpatient treatment center that's a collaborator of this, we can take women that have co-occurring disorders. Luckily, we have the MLADACs that can handle those situations, because recovery coaches and certified recovery support workers are not as well versed in mental health as they are in substance use disorder. So the women get this wraparound service team of a counselor, a recovery coach, a care coordinator, and then it's a family within the house. It's these 8 women who live together. We have weekly house meetings. And we don't have a manager that necessarily lives in the house. We have peer leaders that, have been there the longest, and they take on some of the responsibilities. So that's Compass House. It's the way nonprofits can come together to provide recovery housing.
Well, and I'm struck by what Mark said about, recovery homes are a source of strength, economically, socially, and so forth. What role do you see recovery homes playing, Daisy, in the health and well-being of everybody in the Lakes region, not just people in recovery, but everyone?
Yeah, so we like to say that, so recovery housing creates recovery communities, and recovery communities provide this sense of connection. And connection is the antithesis to addiction, right? Connection is the opposite of substance use disorder. So when we have these recovery homes in our communities that create this sense of connection for everybody, the health and well-being just kind of comes naturally from there. We've got an NH Core certified home in Laconia Reverence House, and they do a lot of volunteering work, civic engagement, their softball teams. They do a lot of community connection. They do various trainings with us. And so by having these models of recovery communities, we're reducing the stigma. And when you reduce the stigma to addiction, you open up the doors for people to access treatment and recovery. And so thereby we're helping other people who need help get into the services that they need, because stigma is still the #1 barrier to anybody accessing treatment and recovery. So having models like Reverence House and Compass House that show what recovery looks like, these amazing homes, these great people, then we do our bit to reduce that stigma.
All right, well, Runji is going to now bring the microphone over to you. We've entered into the Q&A portion of our afternoon. So the four of you will share one mic, and Runji will come get the other one. When you ask your question, give us your name if you'd like, and also where you're from. Also, let us know if your question is for one person on the panel, or if you just like to address it to the panel broadly. In the interest of time, please keep your comments short. I know we're all passionate about this topic and we all have lots of experience, but I'd love to hear from as many people as possible. So who would like to break the ice and start off our Q&A segment? I know this, I've already gotten a sense this is not a shy group, so.
I have a question while people are thinking about it. So Daisy is running a recovery home for women. And we've heard that there's a need for more of these recovery homes for women, especially women who are pregnant. I'm wondering if anybody on the panel or even Kim knows what the rate of drug addiction, drug misuse is among women compared to men. Is it roughly equal? Is it far more men than women? How bad is the problem for women?
Yeah, Daisy, go ahead.
So I'll speak to our statistics at Navigating Recovery, which is a recovery community organization in Laconia. It's 50-50. 50% of our participants are women and 50% are men. When it comes to housing options in Laconia, it's about 80-20. We've got 80% of the beds are for men and 20% are for women. And none of those beds for women include children. We'd love to do that at Compass House, but it's an 8-bed house. There's only so much we can do. So there's a disconnect between the number of people, experiencing substance use disorder and the recovery housing available.
Wow, that's interesting. I wonder why that's the case. Is it just that there's a perception that men need it more, or what do you think? Anybody want to grab onto that? Let's give it to Mark.
I think it's a matter of ease. It's a lot easier to open up a recovery home for men than it is for women. We were talking about that in our group earlier as well, where we have a recovery home owner that found it a lot easier to do. The women, particularly women that have that age, a lot of them do have children, and whether or not they're going to be able to even leave their home, unless the kids are taken away by DCUAF or something like that, is a big question. So.
Oh, I see. So in order to live at a recovery home, if it's just for women, not women and children, they'd have to leave their kids behind, and they don't want to do that. Wow. Okay. So from the audience, and go ahead, Ranji, and go ahead.
Yeah, so I can speak to that just a little bit as well, and I'd support what you both just said. 30% of the certified recovery homes serve women. There's 2 houses that serve women with children. There's, as I said before, there's nothing west of 93 for women, and women can't leave their children if they want to stay unified with those children. So that's a huge barrier. There's also another psychological barrier. If a guy goes and gets into recovery, good for him. He's supporting his family. He's doing the right thing. But oh my goodness, what a tragic mother you are. How horrific. So women face much more psychological barriers to get into recovery housing.
Thank you, Kim. Go ahead, Ranji. Other questions? Yeah. And hi, Laura. It's easy for me to remember her name. So yeah, go ahead.
So, hi, my name's Laura. It's not necessarily a question, or maybe it's a broader question. So I'm a person in long-term recovery, and I grew up in recovery housing, so to speak. My recovery got started in Nashua as a direct result of recovery housing. And right now, like, I live and work in Cheshire County, where there are no female recovery housing available. And I go into Cheshire County jail twice a week, and those women don't have custody of their children right now. So that's not really a barrier for them. And what happens is they are released. And when they are released, they release back into the same community they got sick in. And that looks like going back into the shelter system. And that looks like going back into being unhoused, or going back into domestic situations that are so toxic that they go back into substance use again. And then I see them back in the jail in a few months. And the barrier is that I cannot get them into sober living because they cannot leave the county due to their probation or their parole, or the financial barriers are so high that they are stuck in that county. And I don't know how to fix that cycle other than be there and support them day in and day out, incarcerated.
Wow. Thank you so much, Laura, for being here. I'm especially glad she's here because Cheshire County is often, the western part of the state is often underrepresented in some of these conversations. So there's so much there to what Laura said. And thank you, Laura. Ideas, solutions. It's a very tough problem. Does anybody want to tackle that?
When I mentioned it earlier from our roundtable discussion, but I think everybody at our table were very enthusiastic about the thought about putting together a task force of some sort that involves people from successful recovery communities, that would involve a police chief, fire chief to discuss code, a recovery homeowner, an employer, and maybe even just a citizen that has had the experience of witnessing how a recovery home was successful in their community and making it better, to go to these different communities when needed and have discussions like this with those communities to address those fears and and coming with an attitude of that this is a solution. You have this many drug overdoses last year. You have all these drug and SUD problems. Here's your solution. This is not something that everybody should be thinking, oh, it's going to be a problem. It should be, hey, we already have a problem. What are we going to do
Right.
about it?
It's a shift in mindset. Other questions from the audience or thoughts from the audience? Yeah, someone the lighting isn't good, but I think you have a purple shirt on. Go ahead.
Thank you. Hi, my name is Bryce Kawu. I currently serve on the Manchester Planning Board, and I have a two-part question. First one is more for Donna. So what specifically can municipalities do, especially planning boards, zoning boards, or selectmen, aldermen? What can they do to make their zoning and planning regulations more supportive of or open to these necessary organizations?
So you already hit a major point, which is that you can change regulations. I think a lot of communities think this is written down and this was approved and we can never change this. Here in Dover, we rewrite our regulations all the time. So I think just the fact that you're already open to looking at that. So I think I would actually do an exercise where you work with a recovery house, or you just imagine that you are one and figure out what that process would be if someone wanted to come to you and open up a house, and then look at what the hurdles are and how then to change them. So I would say that's your first step. And then actually going through and making sure that if it's not allowed by zoning, you'd start with your zoning ordinance or any of your site plan regulations, whether it's about parking, lighting, number of people that are unrelated. I don't know how anyone would ever enforce that. So I don't know why it's in codes, but
No, it's
that's
interesting
where I
what
would
you say,
start.
and I know you have another question. It's interesting what you say, though. Sometimes cities think that's the code, and you're saying you can change the code. Yeah.
rules are meant to be rewritten.
Yeah, according to, new situations. But go ahead, you said you had
Yes,
another
and
question.
it's
Yeah,
just a
thank you for
quick-
that one.
It's a quick follow-up, very related to this, and this is more perhaps for St. Anselm. So May 9th, New Hampshire Zoning Atlas is coming out for public consumption. And I'm curious if there is going to be a filter or a toggle that someone in this room could use to see whether or not a municipality even allows recovery housing, or if there are certain restrictions on it.
Bryce, that was a great plug for a big thing coming out from our center on May 9th. A New Hampshire Zoning Atlas is a comprehensive database and graphic interactive map to show every zoning regulation in every community in New Hampshire that governs housing production. It's gonna be a great tool for our state, for researchers, for policymakers, for advocates to understand how zoning is impacting our communities and housing supply and affordability. We currently don't have that toggle on there. We have about 10 or 15 other really important toggles that we'll see, but that's an excellent one that maybe we can consider adding to the Atlas going forward. Thank you for that suggestion, Bryce.
Yeah, and thank you for the questions, because we do have two people who work in sort of city planning, zoning, and all that. So it's good to have questions for those folks and for the folks who work with recovery housing. Other questions from this, I know, not shy audience? Right next to you, Ranji. Yeah.
So this is going to be cynical and probably not as short as you'd like. But we're in a state that pushes booze on its entire population. You drive up I-93, there's an easy on, easy off liquor store. There's revenues, huge revenues that come into the state through booze. So do we really have the political will in the State House to really grapple with this problem at a level? Should these things, they're seductive. They're incredibly strange concepts. And I'm a customer. I'm not like a whatever. Maybe some of the money that needs to happen for these recovery houses needs to come from the state's liquor commission. And I wonder if that can't be something could be explored at the state
I'm
level.
glad you raised that. I had a friend many years ago from DC who came to visit me, and I picked her up at the airport and we drove by one of those stores and she said, "What is that?" I said, "It's a liquor store." She said, "Oh, it's very large." So I'm glad you raised it. I think somebody on the panel wanted to talk about that. Yeah, go ahead, Daisy.
So this isn't going to be a complete answer to this, but we do have the alcohol fund, and it's 5% of the sales from alcohol in the state of New Hampshire gets put into this fund. And for the first time ever, it's being fully funded, meaning we prevention, treatment, and recovery will have access to those funds. So as far as I'm concerned, housing is part of prevention, treatment, and recovery. There's also the abatement funds that, have come out from all the lawsuits with the opioid pharmacies. So you can apply for abatement funding for recovery housing. So it's not a perfect solution, but there is more funding that's available.
So for those recovery homes that are privately run, that aren't nonprofits, though, do they have access to funding like the alcohol fund?
No, you have to be a nonprofit to apply.
Yeah, so that's another issue that this task force that's going to form after today, right, is going to look at. It's a great question. Other questions? Over there, yeah. Ranji's getting her steps in today.
Hi, my name is Chris Healy. I'm from New Hampshire Hospital and representing I'm a psychiatric social worker. So the social work department is tasked primarily with discharging patients. I think we're all kind of somewhat aware of some of the legalities, some of the court
Put the mic a
decisions.
little closer to your
Yep.
mouth. Yeah.
Afraid it was going to be too long. Some of the legalities going on and wanting, ED departments having patients there too long and wanting to discharge patients from New Hampshire Hospital to appropriate settings. So I hear when I think of co-occurring disorders, I have a different picture in my mind. That could mean anything: anxiety disorder, depressive disorder. We have a challenge of folks with really chronic, persistent, severe mental illness, schizophrenia, schizoaffective disorder, bipolar with psychotic symptoms. It is so difficult. This isn't really a question. This is more like a state of the state from where I'm sitting, so how can we facilitate, well, here's my question, I guess. How can we make the state more, I don't know, kind of a little hyper-focused? I think we really need to kind of focus on, again, from where I'm sitting, safe places where people can still get services. And they might have been in the hospital for 6, 7, 8 months, so they're no longer acute, right? So they don't really fit the bill for necessarily a recovery housing necessarily, right? This is so difficult.
So is it how to sort of get the state more focused on this issue? Is that the question? Or?
Or open up the conversation to having folks, set up housing or set up more, ancillary services, especially in, more rural parts of the state, especially.
Well, right.
There's really, there really isn't much north of Concord,
Right.
to be honest with you. And folks are kind of, really spread out. It's multi-systemic. It's, many variables, but I just wanted to throw that out there. And
No, it's
wondering what
good.
other folks, were thinking
Yeah.
about that.
And I know,
Thank
Bill, you're not in a rural area, you're in Nashua, but I do wonder if you could address his question about, how do we get the state sort of more focused on this and more energized around this solution, as Mark put it. Go ahead, Bill.
Just what we're doing, education, public outreach. It's sad, but people tend to ignore this situation and the more we ignore it, the more the problem becomes. In Nashua, we discovered, several years ago that we were treating recovery homes like treatment facilities and holding them to the same standards. And then what we discovered was that recovery homes were going underground. And They didn't seem to exist into the city until we started having our fire department and our EMS people saying, hey, we went to this home and there's 16 people living there, or there's 8 people living here. There's, 12 living here and 6 are living in a basement with unsafe conditions. And so we started realizing that we had recovery homes, but they weren't being kept to any standards. And that is what really triggered in Nashua the conversation of saying, are we doing this right? And when we really started looking into it, it was because we were being overly restrictive in staying black and white with the regulations that were causing the recovery homes to kind of go underground on us. We reached out to the recovery homes folks and had those meetings. We've had great planners in the city that we now have very good meetings involving all of our stakeholders before a recovery home comes into the city, and we talk to them about, here's your hurdles in order what you're going to have to accomplish. And I think for any of the recovery homes, as you're trying to move into a community, it's important to have the conversation with the community first. Don't move in and then ask for forgiveness later. Have the conversation first, figure out what the hurdles are, and figure out what can the community do to help you get over those hurdles. They can often help you. But I think that's really the problem we have right now, is that a lot of these homes still are underground because the communication and the public knowledge of the benefits of recovery homes is just not out there.
Maybe they're afraid to say openly, here we are, because, ask for permission first, as you said, because they don't want to get shut down by the city.
Well, it's that, and
That's the
again,
fear factor.
NIMBYism. They're often afraid to say, hey, we want to open a recovery home in this neighborhood, because they don't want the neighborhoods coming out. And again, because the public isn't aware of the benefits of recovery homes.
Yeah.
Republic looks at recovery homes as a drug treatment facility, much like most of the codes do. And that is the education piece we have to turn around in New Hampshire.
And that was a big report out from my table, education, education, education. How do you work around with that, Daisy? The idea of reaching out to the community, educating the community so that you are welcomed in the community.
So luckily in Laconia, we were very welcomed, but that's because we did a lot of work, ahead of time. We laid the groundwork where we had connections with the police department, the fire department, the city council's office, all of the other service providers in the community. And so we developed this, collaborative where we openly communicate with each other. And so anytime one of us has the opportunity to speak, we make sure that we are educating the people that are listening. And so even if that's like going to a Rotary meeting or a different, lunch, business will have a luncheon and they'll ask a speaker to come in. Every time we're offered that opportunity, we talk about stigma reduction, we talk about the work we're doing. And a lot of times those talks are given by someone who's in long-term recovery. And so at the end, when they say, and I am myself, I'm in long-term recovery, everyone's like, wow, it's like, yeah, that's what recovery is, right?
Mm.
And so we just kind of hit them over the head with it. And it's, the hospital's involved. Like, we just have this great collaborative community where if you have the opportunity to speak, you got to put that 5 minutes of stigma reduction in there. Otherwise, you're going to hear from me.
Wow. So like Bill said, a lot of the groundwork, you lay a lot of the groundwork by making those connections. And I love the idea that you're sending people out to speak at these little Rotary groups and Chamber of Commerce and whatever it might be. Other thoughts, questions from the audience? We have time for 1 or 2 more. If not, I always have questions up my sleeve, of course. Oh, okay, now we have a whole bunch. So go ahead, this gentleman back here with the white shirt. Mary's got the microphone there.
Thank you. Donna, you said something profound, and I don't know if everybody actually caught it. If you consider it a single family, you're actually not going to the zoning board and the planning boards. And so you're actually not going to face the barriers. I'm not saying there shouldn't be restrictions. And, obviously, if there are complaints, let me be very clear. I respect every city official here, the emergency personnel, and I'm not fighting for no regulation at all. But I think there could be a middle ground there where it could be classified as a single family, because technically by law, if you look at the Fair Housing Act and the Disability Act, I did sue a town 7 years ago and won, because they told us we couldn't be there. And we fought them on those two laws and we won. And I don't want to fight a town ever. I don't even own recovery housing anymore, to be honest. So, but could there be an avenue? How did Dover decide to take that stance is my question, because it's a, you know, it's a unique stance that most towns aren't taking
Yeah,
in the state.
that's really interesting. Yeah, go ahead, Donna.
Yeah, we took it probably about a decade ago, just to simplify it and just make sure that we weren't having any discrimination without meaning to. We just changed and took out our definition of family. And it was also one that we said, how would we ever, we're not going to go in and say, oh, we need a blood test done, or we need to see your licenses to see who's related or unrelated. So we just wiped out the definition of family and, you know, it's a single family house. And that's how we would treat it. I know Bill wants to follow up.
Is that unique?
So each community is different and each community can set their own regulations. I don't know how unique it is, but I think certainly some make it more difficult than others. And others are, I guess, trying to make sure it's more open and friendly.
Yeah. Go ahead, Bill, real quick, and I think we have one or two more.
And I do think part of that comes down to your code officials, you know, to actually evaluate the building and what the use is going to be. You know, if the use is going to be a treatment facility, it reclassifies that 1 and 2 family dwelling. But if it's going to be a recovery home and there is going to be no treatment going on there, and is it still going to be used as a single family home? That's the decision up to the code officials. And again, it's not going to work in every community. It comes down to the code officials to be to a level of comfort where they can say, can I back this up on a court of law? I've made a decision that we're going to permit the recovery home as a 1 or 2 family home, and the use is not a change. That's can be risky. I will say that in Nashua, you asked for about a quicker path. Certification is a very quick path for us, because that's holding the recovery home to a standard that's, I found, even higher than what the building codes hold to. They do unannounced inspections, making sure that they're meeting the criteria of NH Core or the national standards. That's something that the communities, if you're looking at this and you're looking at a way to help give you that level of comfort as a code official or as a planner, certification is a really good path, and I highly support it.
I think we had 1 or 2 more in this area. Mary, you want to? Yeah, go ahead.
Hi, Andrew Warner, City of Manchester. I work mostly with folks that are still using drugs and are unhoused or are housed and using drugs. And really grateful to be here. This is a really fantastic conversation. I'm looking for housing for folks that are still using drugs and that are unhoused and that want something different. And I would kind of like challenge everyone in this room to think like, is recovery housing after someone gets sober? What drugs are they using? Which ones are acceptable? But also, what are we doing for our population that's still using drugs and wants to do something different? And the hurdle is massive. So what are we doing about that?
Yeah, no, that's really important. And I'm glad you raised it. Daisy, yeah.
So, okay, so we have a huge unsheltered population in Laconia, and we're trying to address that issue. And with our unsheltered population come a lot of people who are actively using substances. So one of the options on the table right now that we're trying to work towards is creating a shelter community where everybody has their own individual unit. So they have their own bed, they can lock their door, they can keep their possessions there. There's a community space, there's bathroom space, right? But I'm looking at it as there will be service providers that will go to this community on a regular basis, daily, hourly, checking in on folks. But we're looking at it as a place for someone to have respite, right? Just a safe place to live, a safe place to sleep at night. Because I think once your cortisol levels come down from living like that, once you have a chance to kind of check in with yourself, I picture more people saying, yes, I'm ready for help, versus working with someone who's unsheltered living in a camp. They're not ready for treatment yet. So we're trying to create this shelter community where someone can lock their belongings, can shower, can be safe, can sleep safely at night, with the hopes of within 30, 60 days, they've come back to a regulated point where the idea of treatment and recovery is more appealing again.
Wow, that's
it's
so
not-
important. I love what you said about, housing, some people say housing first, right?
Yeah.
Bring the cortisol levels down so that you're ready to take that next step. Yeah, go ahead. I didn't mean to
I mean, if
interrupt
we
you
think
there,
about
Daisy.
any disease, any illness that we have, none of us could manage it unhoused. And so this is just an opportunity for us to give someone that housing. It's not perfect. It is warmer than a camp, it's safer than a camp. But an opportunity to start to manage their illness before we ask them to do anything else.
Yeah, I just wonder if you have thoughts about that too, Mark. We didn't get a chance to get into it too much, but Mark is, again, recovery-friendly workplace. So you're sort of shoulder to shoulder with folks who are going through recovery, who are doing their best. I'd just love to hear your thoughts about the role that recovery housing plays in their recovery, since you've seen it up so close.
Yeah, sure. So I think it really starts, and it comes back to the story about Littleton and how by happenstance, things just kind of happened. I think it comes down at the root of it to compassion for other people. There's a hidden truth about people that are in recovery. For example, I can make my resume, right? And I can put on my resume all these problems that I was able to fix throughout my career, increased efficiency by 30%, did this, did that, right? Sean here has a better resume than me, in my opinion. Because Sean could put on his resume that he beat addiction. And that's way harder than anything I've ever done in my life. I started smoking cigarettes when I was 12 years old. I still have a nicotine patch on because I can't beat it. I do not have the strength of character as this man sitting at this table right here. And that's why I admire him so much, and all my employees that are able to successfully go through recovery. So if you can get that across to other people that are ignorant of that hidden truth and that are ignorant of the benefit that recovery homes can bring to your community, if we can find a way to get that across so that other people can internalize that, there's going to be a lot less stigma involved, and that's the perspective that I come from with any decisions that I have to make, whatever it is, whether there's rules or guidelines or whatever, I don't care. I'm going to find a way, whatever it takes, to be able to do the right thing for that employee, for that individual, or for, whoever it is that is struggling.
And in terms of city officials, you told me, Mark, on the phone that, during the pandemic, when it was so hard to find workers, people in recovery housing saved you because they have to be working and they came to work for you.
Yeah, that's another benefit for employers too. 2020, everybody knows what happened in 2020. I'm not going to say the word. After that, it was really, really hard to find anybody for labor. I mean, it's like, where'd they all go? They all just disappeared. Quarantines were lifted and everybody was starting to go back to work. They stopped paying people to stay home, but yet people still weren't coming in. 2021, I could not hire anybody except for people that were working for the recovery home. I don't remember how many I hired that year, but and this isn't hard data, but I'm pretty sure only one, maybe two people that I hired that year were not in recovery. And I hired at least 40 people.
Wow, it's a lot.
Yeah. And they were all in recovery. At that point, my percentage of people that were in the recovery group was probably, compared to my whole workforce, was probably about 30 to 35%.
Well, we know many of you have to go back to work. We promised to end promptly at 1:15. I really want to thank the panel for coming up here with me and just giving us your perspectives. Donna Benton, Director of Planning and Community Development for the City of Dover, also President of the New Hampshire Planners Association, and Mark Bonta, who we just heard from. He's on the Advisory Council of the Recovery Friendly Workplace Initiative. He's the Plant Director at Genfoot America, and Daisy Pierce, Executive Director of Navigating Recovery of the Lakes Region, and Bill McKinney, Building Official Manager for the City of Nashua and President of the New Hampshire Building Officials Association. I really want to thank the audience too for just engaging in this discussion with us. I loved hearing the report outs from the roundtables. That was great. I'm going to turn it back over to Professor Max Latona for some final thoughts to wrap up our day together.